Good afternoon. It's Bruce Stanton here. Just getting through the very difficult time that everyone is going through with this health emergency across our region, and happy to be on Rogers TV today to talk to Josh and to relay a bit of information that is continuing to come in as we serve the area here and right across the region of Simcoe North. There's some amazing effort going on to help people that are being impacted, a broad swath of people in our region impacted by this virus, not only certainly health-wise, but also with regards to employment and livelihoods are being impacted as we all are making this shift to social distancing and keeping our distance so that this virus will stop multiplying through the community as we're seeing the numbers increase right here in the province of Ontario, but certainly right across the country. So happy to provide a little bit of information today, and hopefully this will be helpful for viewers. So one of the things we're doing is, as new information comes in, we're getting principally from our government sources and sources that we can trust to get good information and links up on, certainly on my website. That's brucestantonmp.ca. But also on my Facebook site, my MP page and Facebook, the same information is up there. And we're available, my constituency office, while we're restricting person-to-person meetings to only those that are essential, available by phone and by email on a regular basis and through social media. I mean, you can reach us through messaging as well. So we're still at work. Where Parliament will have to go back for maybe a day or two next week to pass some of this legislation, but the staff are all on board here in the riding in both Midland and Orillia. We're seeing certainly from the people in the public health and healthcare sector right across our region at GBGH up in Midland Penetanguishene, at OSMH in Orillia, at RVH, which, as we know, was really the site of the first COVID-19 fatality in Ontario. Some heroic work going on by physicians and public health care sector workers to meet the growing what appears to be a growing demand and needs as this virus is finding its way into community person-to-person transmission. So how is Simcoe North dealing with this? One only needs to take a short drive around our riding and see just how quiet things are. Retail stores are closing. Certainly restaurants and bars and other like establishments are mandated to be closed now, or at least limited to just takeout. So people, I think, are really heeding the advice and making sure that they're doing everything we can to stop the transmission of this virus. And it is critical, I will say, because even though it's similar symptoms to what one would have with a common cold or flu, there's no doubt that this particular virus, for which there's no vaccine, is more lethal, and that's especially so for elderly people, and anywhere is up to 10 times more lethal than the typical flu. So we all do our part to keep people safe by keeping our distance and washing our hands and making sure that we don't give this virus a chance to be transferred. It's pretty clear that the closing of borders, at least to all non-essential travel, is an important step here. Admittedly, as you will hear from healthcare professionals, this has made it into Canada now, like other countries, the U.S. to the south of us. Once it gets into community transmission, it is more important to make sure that we're protecting the people who are particularly vulnerable to it, the elderly to a great extent, more vulnerable to this virus. But closing the borders is simply eliminating one more aspect of non-essential transmission or person-to-person contact that might be finding its way into Canada. I think it's in the initial days, healthcare professionals were taking care to make sure that they could trace where these were coming from in an effort to contact people. The more and more this becomes community transmission, it's very clear that our efforts and measures around social distancing and washing and so on, that becomes even more important. The key thing with the border, though, I mean, we in Canada so much rely on the border being able and ability for goods and products to get across the border, our supply chains for groceries and pharmaceuticals, all of the essential goods that we will still need, even if we're in, self-isolating or in our homes and staying at home, we still need to get out and purchase those essential needs. So keeping that Canada-U.S. border open for goods and products is absolutely essential, and I'm glad that both governments have understood that well. So you'll know that, of course, the provincial governments, for the most part, because they take the lead on healthcare and healthcare services, and even things relating to transport and communications within their jurisdiction, really take the lead in cases like this. They were the first to declare emergency situation in their own provinces. So they have been working in great concert with the federal government, who does take a role in certainly some of these financial measures like EI, but also in Canada's relationships with the other countries around the world. As you've seen, especially with Canadians who are now in different parts of the world, upwards of 3 million Canadians at any given time could be abroad. And so you can imagine to the extent to which, as we put the calls out for people to come home, the government is working through diplomatic channels to try and make that happen. We're doing that too at an individual basis. But get back to the cross-government cooperation, I think it has been really encouraging to see governments of every stripe working closely together, putting the public interest and public safety first and foremost. This is not a time to be talking about political differences. We'll have those discussions at a later time, and there is good cause to have raised questions, as there will be. I think every one of any time a situation like this confronts us, and I can never remember one quite this with this many consequences to it in terms of the local economy, the way we've seen. But we will want to see, of course, at a later time, a review of what we did right, what we did wrong, and there'll be ample time after the fact to review these things. But for right now, we've got to concentrate on being there for Canadians, being there for people, in my case, in the riding of Simcoe North. That's where I'm keeping my focus. Well, essentially, I just want to encourage everybody to keep doing their part. As we've discussed, this is a very unusual and unprecedented, and I should say evolving, where there's still a lot of things that we don't know. Canada is not near at the point yet where one could suggest that we've peaked in terms of the number of cases of COVID-19 infections across Canada. So we still need to be vigilant. But I think all of the experts are telling us that the more we do now to prevent those hospitalizations, to prevent this virus from being transferred from one person to another. That's the only way, I'm told, that it can duplicate and continue to be transmitted. So if we stop doing that, we're gonna halt this thing in its tracks. The sooner we can get back to normal, as difficult and as impossible as that may seem right now, that's the path we want to get on, and we want to get back there as quickly as we can, so we can resume some degree of normalcy in our lives. I just wouldn't want to conclude without, as others have done so well and eloquently, is to thank and congratulate the people who are out there making our communities still operate. Everybody from postal workers to certainly healthcare workers, people who are working in our utilities and in our systems like Rogers that are keeping our internet access still operating, and all of the apparatus that makes our our society and our community work and function even at difficult times like this. They all are owed our congratulations and our thanks. And that's especially so for people who are on the front lines, people who are working in hospitals, at assessment centers, who are caring for the elderly, either in centers but also in home care. Some real great work going on to pull together and get every one of us through this situation and put this behind us as quickly as we can.